Good morning. It's May 21st, and this is your daily brief in science. Here's everything you need to know. A U.S. Surgeon General advisory calls on stakeholders to act now as excessive screen time threatens both physical and mental health in children. The document highlights poorer sleep, behavioral issues, and reduced physical and social activity as linked outcomes, framing action as a bipartisan urgency rather than waiting for certainty. Background notes include the absence of a confirmed Surgeon General, with interim leadership from HHS officials and involvement of Melania Trump's Be Best initiative. The advisory urges practical steps, age-based limits, none under 18 months, under 1 hour daily for under 6, up to 2 hours daily for ages 6 to 18, and a family toolkit for families, schools, providers, policymakers, and tech companies. For schools and health providers, it recommends bell-to-bell phone restrictions and routine screening of students' screen use during annual visits. Families are asked to create a family media plan, and clinicians should assess patients' screen use, while more research on long-term effects is called for, and tech companies urge to warn users about risks. Officials stress that action cannot wait for perfect certainty, presenting screen time as a broad societal concern about youth mental health. The American Academy of Pediatrics has noted that digital ecosystems can prioritize engagement over healthy behaviors, potentially contributing to negative outcomes. The advisory calls for broad actions across sectors, including design changes to prioritize user well-being, pre-use warnings, and nudges to limit use, though it does not lay out a detailed enforcement roadmap. Media coverage describes the advisory as guidance for parents, caregivers, and educators on managing children's digital media use, with experts cautioning against one-size-fits-all rules and urging targeted screening and prevention for those at higher risk of addictive patterns. A new exhibit at UC Berkeley's Lawrence Hall of Science blends Ohlone knowledge with mixed reality science displays, marking the first co-designed exhibit with East Bay Ohlone youth and elders. The project centers on Utka, the place of the acorn, and shows a convergence of traditional knowledge with modern technology, guided by Ohlone youth in digital design discussions. Ohlone youth ambassadors helped shape the exhibit, calling for deeper cultural representation and prompting practical changes like adding name tags to affirm roles. After an NSF grant of $1.4 million was terminated in 2024 as part of broader funding cancellations, the team pursued alternative funding, hosted community events, and continued development. A federal court later ordered restoration of reinstated funding for UC researchers, with the DOJ defending agency discretion in funding decisions. The initiative began in 2023 with the NSF grant to showcase Ohlone ecological knowledge and promote STEM among Indigenous youths, but the funding termination prompted a shift in approach. Following the setback, community events shared prototypes with Ohlone members, emphasizing acorn ecology and visitor accessibility. Despite funding threats, the exhibit moved forward with support from Ohlone families and collaboration with UC Berkeley's School of Information to translate and adapt materials for broader accessibility. The project continues to expand Chochenyo language inclusion and Spanish translations, grow the Ohlone Forward Café, and strengthen UC Berkeley's relationship with Indigenous communities, all under the AUDA initiative. Future Lawrence Hall of Science programs will embed Ohlone perspectives, include Chochenyo language and Spanish translations, and expand Ohlone Forward cuisine in the Museum Café. A new AI-driven tool maps obesity-related changes across the entire mouse body, aligning 31 organs, nerves, and immune cells at cellular resolution. MouseMapper automatically segments tissues and tracks immune cells, enabling quantitative analysis of peripheral nerve networks with strong generalizability across imaging methods. A multidisciplinary team from Helmholtz Munich, LMU Munich, and collaborators published their findings in Nature, presenting whole-body mapping capabilities powered by foundation model-based deep learning. The researchers also generated and publicly released whole-body datasets to let scientists globally explore obesity-related multi-organ changes. Those datasets are available online for researchers to examine how obesity reshapes tissues across the body. The study emphasizes a shift from studying single organs to holistic whole-body analyses to understand disease dynamics and identify new targets. Lead investigators envision future development into digital twins of organisms for in silico disease modeling and drug testing at cellular resolution. Spatial proteomics of the trigeminal ganglia revealed 230 proteins with pathways linked to actin cytoskeleton, RHOGT pace effectors, axon guidance, inflammation, and immune signaling with downregulated serpin. A family members potentially relating to inflammation and tissue damage. The immune module achieved higher segmentation accuracy with voxel dice around 0.788. Showing robustness to signal variability and generalizing to tissues not in training like liver and gut. Spatial proteomics in the trigeminal ganglion indicated nerve remodeling and local inflammation, with parallel molecular changes observed in human trigeminal tissue from individuals with obesity, suggesting conserved neural pathologies. In obesity models, MouseMapper exposed widespread immune cell clustering changes and significant reorganization of the trigeminal nerve, including reduced branching and endings linked to diminished sensory responses in behavioral tests. Obesity induced by a high-fat diet caused widespread changes in immune cell organization and nerve architecture across tissues such as fat, muscle, liver, and peripheral nerves. A new push amplifies the voice of the clinical research workforce as part of ACRP's 2026 Research Rising campaign, aligning federal outreach with grassroots, state, and local advocacy to raise visibility and support for those powering medical innovation. Proclamations highlight the vital role of clinical research professionals, from scientists and coordinators to nurses, patient advocates, and regulatory experts in improving patient outcomes. The effort aims to expand proclamations in the coming years to strengthen awareness, support the workforce, inspire future talent, and speed translation of discoveries into patient cures. Global trial progress builds on Lin's method, now incorporating placebos, double-blinding, and strict adherence to ethical standards such as the Nuremberg Code and good clinical practice. Clinical Trials Day, observed on May 20th, commemorates the 1747 first randomized trial by Dr. James Lind during a scurvy study aboard HMS Salisbury, marking the birth of the modern randomized controlled trial and evidence-based medicine. The day honors Lind's landmark work and recognizes the contributions of patients, caregivers, researchers, and the broader research community. A Clinical Trials Day 2026 site provides more information and a gallery of proclamations with opportunities to get involved. Additional resources and involvement details are available through the Proclamation Gallery and related materials. Overall, Clinical Trials Day is presented as both a historic homage and a practical strategy to validate and bolster the clinical research workforce while acknowledging ongoing challenges, including a workforce crisis with high turnover and staffing shortages that threaten trial timelines and reports of impact on up to 95% of cancer centers. Officials emphasize that the recognition is meaningful beyond symbolism, signaling ongoing efforts to elevate the profile of those advancing science and access to trials. A 1-week radiotherapy schedule for early-stage breast cancer delivers the same long-term control as the traditional 3-week course, with very low recurrence over 10 years. The fast-forward trial, involving over 4,000 patients, confirms no increase in long-term side effects with the shorter, higher-dose schedule at the 10-year mark, and shows recurrence rates of 3.6% for the 3-week course, 2.9% for the higher-dose 1-week schedule, and 2.1% for the lower-dose 1-week schedule. Researchers describe the approach as safer, more effective, and more convenient, highlighting improved patient quality of life and reduced strain on the healthcare system. Leading experts say this provides definitive long-term evidence in favor of shorter radiotherapy schedules. The potential healthcare impact could be transformative, with millions of patients benefiting from a lighter treatment burden and hospitals facing a lighter appointment load. Karen Davis, a trial participant, shares her remission experience and notes how shortened protocols can affect daily life and psychosocial well-being. She also discusses her post-treatment work in wigs for cancer patients and her willingness to advocate for shorter treatment. Real-world experiences from participants illustrate how shorter treatment can improve daily life and enable support for others with lived cancer experience. Since 2020, tens of thousands of UK patients have benefited from shorter radiotherapy under the National Health Service, and the study published in Lancet Oncology by the Institute of Cancer Research and Keele University reinforces those practice changes. The trial's sponsorship by the ICR underscores the collaboration behind widening adoption while emphasizing that patients were involved across the study, with no rise in long-term toxicity observed at the 10-year follow-up. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.